we want to do all of these things. We would like to be able to see in the end, mental health and well-being for all Filipinos. We have interventions, and we have policies that we forwarded to prevent and promote illness and promote mental health. There are information and researches that we are doing, mental health information systems that we are setting up. There's a governance systems that we are also setting up. Services are going to be made available. Let's take a look at this framework. It says there, it's not only the health system that is going to do this, but this is actually a whole of society, whole of government approach, so that even when people who are still well are able, to access services, that will make sure that they continue to stay well. If they're sick, then the health system is able to provide the services that are going to be needed until they are going to recover. Next slide. So this is what we see now as the services that we have. Wala po talaga tayong mga masyadong maraming serbisyo when it comes to self-care, informal community care. They're very limited primary healthcare integration. Ibig sabihin po yun, ang ating pong mga local government units, very limited pa ang capacity nila to provide the services. And the mental health services that we have really is in the upper portion dito po sa mga hospitals po natin. But what we would like to be able to see is in the next slide. We would like to be able to see that doing all of this now that we are doing, so what we are doing now is we're providing capacity building for local government units to provide, to be able to assess mental health conditions and able to provide the necessary services. We're providing medicines that already made them available at the local government level, community level. We're developing guidelines for community-based mental health program. We're strengthening mental health advocacy and promotion. Kasama na po dito, dapat marunong po tayo ng self-care on our own. Our communities are able to provide different services that are going to be that are there, that may accessible po siya. We promote human rights, and then we're developing licensing standards so that lahat po ng hospital dito sa Pilipinas are able to provide services. Next slide, please. And this is, and doing all of those things, we would like to focus, refocus, shift our focus from specialized services doon sa pinakamataas, mga hospitals ang nagpo-provide, to integration of these services into the general health and community setting. Next slide. And this is what we would like to be able to see from this current reality of an inverted pyramid. We would like to be able to see in the end that maybe in the next 2 years or so, or 3 years, we are able now to have an effective mental health program at the community settings where community people themselves are running. Community people themselves are able to provide services and are all mental health care providers. And then able, if they have problems, they're able to refer them to the primary care level. Mga local government units natin, mga rural health units are able, to provide the services that are needed at that level. Kung hindi na talaga maagapan, then they can send these patients and refer them to higher levels of care to our general hospitals or even to our psychiatric hospitals. Next slide, please. Just would like to say this, with all of that in mind, and we are already working on establishing all of the different standards, and maybe we will be rolling them out next year. I would like to say that a recent study, a recent study that was released here just very recently, 2021. This is an evolution in anxiety, depression with the progression of the pandemic in adult populations from 8 countries and 4 continents, and Philippines is one of them. It shows there that from the very beginning, ito po kataas yung ating score, and mas lalong tumaas pag sa sunod na wave. Okay, let's see the next slide, please. And if you are going to take a look at it, the probable generalized anxiety disorder and major depressive episodes was indicated 30.1% during the phases 1 and 2. And in phase 2, 32.5 with a 7.9 increase over time. So talagang nag-increase po yung anxiety disorders, manic depressive episodes, nag-increase po siya. And what is notable here is that it is high in the Philippines. 38.8% po yung variation na nakita po dito. So mas mataas po ang increase dito sa Pilipinas. And this proportion exceeded 50% among the young adults in all countries except for Switzerland. So kasama na rin ang Pilipinas dito. And there were several factors that negatively influenced mental health in times of this pandemic na nakita nila: young age, weakness of appearance, false beliefs, and self-isolation and quarantine. The reason why I'm showing this to you is because when we are now going to take a look at how we will implement all of these things that we have put in place, that we'll be putting in place, we will make sure that all of these negative factors, all of these factors that negatively influence mental health in the times of a pandemic is going to be addressed. Because, next slide, next slide please, though we have already entered into a new era where psychological suffering and the rising demand of mental health interventions is there. We are being dominated by all of this. It is something that we cannot deny anymore, and that more than ever, we need to innovate and build interventions aimed at strengthening these key protective factors. And we will make sure that we are able to do that as we go along and build a resilient mental health system in the country. So thank you so much. So good mental health, my last slide, is critical to the functioning of society at the best of times, but it must be front and center of every country's response to and recovery from the COVID pandemic. So that's my last slide. Thank you so much.
Maraming salamat po, Ma'am Presi, for giving an update po with regard to the policies and program for quality mental health. I particularly like the slide po that you showed wherein you shared now we are not all on the same boat, but we are on the same storm. It's also reassuring to know that the Department of Health has taken communication initiatives on social media platforms, on other services, especially in the communities po. Para po mas marami pa po tayong malaman with regard to the updates on the NCMH Crisis Hotline, we have with us Dr. Bernard Argamosa. He's a medical specialist and a consultant psychiatrist. He's currently the program director of the National Center for Mental Health Center for Wellness, the 24/7 Crisis Hotline, Mental Health and Psychosocial Support Philippines, and Wellness in the Workplace. Dr. Bernard, you now have the floor. Thank you po.
Thank you very much and good morning to everybody. Let's start with this. Okay.